Authorities are calling for parents to take a more proactive role in raising their children in an effort to mitigate the rising rates of teenage pregnancy. The trend of young girls falling pregnant well below the age of 18 is continuing. Teenage pregnancy continues to be rife in provinces such as KwaZulu-Natal and the Northern Cape. Now, KwaZulu-Natal recorded 26,515 teen pregnancies in 8 months, while more than 3,000 schoolgirls between the ages of 10 and 19 have fallen pregnant between last year and March this year in the Northern Cape. To discuss this matter of teenage pregnancies, we joined virtually by Basic Education spokesperson Mhlanga and, of course, Lovelife CEO Patrick Kulati. Gentlemen, thank you very much for joining us. It's good to have you to talk about a very, very important issue this morning.
Thank you so much. Thank you for hosting us.
Thank you.
Yeah,
good morning.
Such a pleasure. Thank you. Elijah, let me begin with you. I mean, we already know what the problems are, and we need to focus on finding solutions for these problems. When we look at schools and we look at how schools are trying to prevent teenage pregnancies, what initiatives are in place to try and assist this?
Well, Leanne, there's the initiatives that are in the classroom in terms of the curriculum offering, but there are also initiatives that are outside the classroom in terms of activities that we do together with our partners such as Lovelife, for example. In the curriculum, we teach about sexual health, we teach about prevention, we teach about through life orientation, taking care of yourself, respecting others, and making sure that you know the implications of the things that you're doing as a young person, but also strategies on how to detect potential danger and what to do with it in terms of reporting predators or reporting rape where it happens and reporting unintended sexual activity, which is what we see to be happening in most schools. So there's a bit that we do at school and outside the school together with our partners.
Yeah. Let's go to the home now. So, and I think it's an important point to start on with, because schools can do so much, but the reality is that this all needs to begin at home. And Patrick, let me come to you here, because one of the criticisms is that parents are not enough involved in their children's lives. Obviously, that cannot be the entire blame, because there are many reasons associated to this. But let's look at the family structure in South Africa, because we are dealing with what we do have right now is the highest teenage pregnancies in the world, and that's a reality. So let's look at the family structure and perhaps how that contributes towards these rising rates of teenage pregnancies.
Thank you so much, Leanne. Good morning to the viewers. Indeed, the school is a microcosm of what happens outside the school. And some of the solutions have got to come from the community. So what you have not just the family structure collapse, you also have the community structures collapse. For example, people that used to be trusted in society, like pastors, like teachers, principals, parents, uncles, all those kinds of people are involved in so many dysfunctional behaviors that lead to the home being a collapsed environment. You have a situation where you have child-headed homes where there is no parents. Even if parents are there, they are not providing guidance. They are not providing a direction and education to the children. Some of them are difficult for the children to speak to about the issues that they are facing. You see, the problem is both at the individual level of the young person, who has, I believe, as Lovelife, we believe that young people have agency. They have agency that derives from the Constitution. They have rights. They can make decisions about their lives. But then there are situations which are broader than them, where these older people that have been called blessers, they give them money. They know that they are poor and all of those kinds of problems. So the home is at the core. And unfortunately, in our society, the home environment has collapsed. The fathers are not there. Some of the parents are young kids themselves. So it's a multiplicity of problems. We need religious institutions, we need NGOs, we need to work together at home so that we can improve the situation.
Yeah, I mean, as you say, it is so intense and so difficult. But one of the other issues, and of course, it's that family structure that is really key to trying to change these views and help. But there's also the issue of educating these teenagers and even earlier than teenagers, because we're talking from 10 years old here. I mean, these are the rates we're talking in this particular study that's finding that there's the massive amount, over 90,000 pregnancies in a year between the ages of 10 and 19 years old. So education, you know, a lot of the time it's found that it's taboo to speak about it at the home, or they don't want to, or they don't know how to actually speak about sexual behavior and what to do and what not to do, the use of contraceptives, all of these kind of things. So a lot of it comes to education. And Elijah, let me bring you in here. So some people calling for a much earlier approach to talking to sex education at school. Could this help? What are your views on this?
Well, Leanne, it's already there. We call it comprehensive sexuality education. It's scientifically accurate information, age-appropriate and culturally relevant information, which we give to our children right from primary school through life skills. When they get to high school, it's called life orientation, where we talk about all matters regarding sex and sexuality. The view there is to empower them to understand their bodies, how they function, and the changes that will occur, and what the next person would want to do with them. Because we say, if you understand the sacred parts of your body, you will not want anyone to touch those parts of your body, so that you understand what the implications of that will be. But we also talk about prevention. Prevention is the biggest thing that we are teaching our learners in the curriculum. But we also know that it occurs. Sexual activity is something that is there among children. So what we have had in this country is a situation where you have organizations such as the ACDP, African Christian Democratic Party, who have been very vocal, very open about opposing comprehensive sexuality education, even though it is designed to empower children, it is designed to reduce the occurrence of learner pregnancy or teenage pregnancy in the country. But in a time such as this one, they are quiet, complete silence, absolutely disappointing. Because as a stakeholder, they have a role to play. Instead of opposing, they could be coming with alternative solutions. As a basic education sector, we have a curriculum content that focuses on tackling these matters honestly and robustly so, but doing so, making sure that we are aware of the age of the learner and the type of information that they should be exposed to. Yeah. So we are doing our bit on a daily basis. The question is whether our other partners outside the school environment are doing their part on a daily basis as well, because that consistency is absolutely critical.
Yeah, I'm going to ask our producers to put up a couple of the views coming in from our viewers here during this interview, because that is our question of the day. And a lot of our viewers are speaking to the fact that we really need to educate even more. It may be introduced at schools, and I do know that, Elijah. I mean, that is part of it, but clearly it needs to be almost more comprehensive. It needs to address the students perhaps from a younger age and get them to understand the dangers associated with teen pregnancies, and also maybe educate more with regard to contraceptives, STIs, all of these kind of things, because it is certainly an issue of education. If it's not happening in the home, it has to happen more comprehensively in the school. So perhaps you want to address that, because these are one or two of the comments that I'm picking up, that parents are feeling, I think we need more. It needs to be a stronger presence of sex education in schools from a younger age.
Yeah, thanks, Leanne, for that question, because it gives me an opportunity to tell you that over the past 15 to 20 years, we conducted research which indicated that our teachers in schools were not teaching everything because of their religious beliefs and some of their personal prejudices. They were not teaching all the content that was there. We then moved on to implement what we call scripted lesson plans to make sure that every teacher in every school, they teach exactly the same thing and cover all the content that we've given them. So that was part of strengthening that teaching component that you are talking about, to make sure that we are comprehensively doing that. We are not skipping any parts, as some of our teachers were doing. So that part has been covered. And in the curriculum, we start from grade 4. It's there. From when these children are young, we introduce them gradually to these subjects, and they become even more difficult and more complex and more open and frank as they grow, because, as indicated earlier, it is scientifically calculated to make sure that it addresses a child who is at a particular age. So it is there, it is happening. But some parents and some organizations are accusing us of sexualizing their children. They say it is their God-given right to teach their children about this. And so for as long as we have that type of opposition, which is funded, by the way, we have seen that it's also funded hugely by some organizations who don't want us to be exposing learners to good quality information that will preserve their lives and their future.
Yeah, and I know you and I have spoken about this quite intently, but I think people need to understand, and we need to get to a point where we do understand that this is a plague that really is bringing our teenage girls down at the moment. I mean, the amount... I am going to come back to you, Patrick. I've got a lot to speak about, but just while I'm on the issue of education, Elijah, can we perhaps give a figure in terms of girls dropping out of school because of teenage pregnancy? And this is a very big issue, because there are a high number of school dropouts, and this creates a very bad future for a young girl who doesn't go back into the education system, who's now got a child to look after. And we talk unemployment. The unemployment levels here in the country are massive, but without an education added to that, what chance does a young girl have? So perhaps talk to us about the issue of dropouts.
Well, you're correct. Some of the people, the learners that drop out of school, they do so because of pregnancy. But what is important to note is that the policy on the prevention of learner pregnancy in our schools, which has been in implementation for some 18 months or so, does not agree. It says a learner must stay in school as enshrined in the Constitution, that the learner's right to education should not be interrupted by anything. So the policy that we are implementing now, it says and affirms that right of the learner to stay in school. It says schools, families, everyone has a responsibility to support that child. Talks to the issue of stigma as well as discrimination, that even when that girl child is pregnant, they should be able to continue with their education. And it says also that as soon as they've given birth, they should return to school. We have seen some schools doing a good job of getting the names of the learners who have fallen pregnant and preparing catch-up plans for them, making sure that they don't miss out on any schoolwork. That is commendable, but we need more of that in all our schools. The most important thing to remember is that no child, no girl child should be chased out of a school because they've fallen pregnant. The policy does not agree. In fact, it says that that child must be supported. One of the core intentions of the policy is care, support, and comfort for those learners that have fallen pregnant, so that they too are able to continue their education and that they don't drop out of school. Yes, in terms of the dropout rate, the numbers of pregnant learners do contribute to the dropout rate, and we don't want to see any of that taking place simply because a girl child has fallen pregnant.
Patrick, now let's come to you, and I'm reading some of the most interesting views that are coming in from some of our viewers. We unfortunately can't put them on air, but I will read one or two to you. But Patrick, how's this for a comment that's come in from one of our viewers in Kulati? The social grant is the main problem. 12, 13-year-olds, they don't even have IDs. They have children because they know they will get a child support grant, and they use this grant as a form of employment and keep having children. Talk to me about this. It's not the first time I'm hearing something like this. I mean, what are your views on this particular issue around child grants, teenage pregnancies?
It's a difficult one, Leanne, because I've read some studies which show that the problem of teenage pregnancy is a global problem. In Africa, it's a big problem. For example, I read that Nigeria is a leading country that has this problem. Now, I don't know if all those countries provide grants to their children. And so it's very, very difficult to me to make that categorical link, because there are countries in the world that do not pay grants where this problem is happening. So let's deal with the problems for what they are, because one of the key issues here, Leanne, is the relationship between poverty and coerced sexual relations with older men. That's one problem. As we have spoken earlier on, it's about the breakdown of family structures and the things that we talked about, the vulnerability of child-headed homes. So these are the problems that we are facing. Now, if I can just bring in the other issue here, which is that we tend to analyze and raise awareness as a country. But the problem of holding some of the people accountable, I think it's lacking.
Yes.
This is where we need more of the community to come forward, so that the people that we know, we live in the communities, we know Woodbani is doing this and this, we know this is happening here. So the whole police and justice system needs to hold these people accountable even more, including some of the teachers that are doing these things, so that our children can be protected, so that they can then have the right to decide for themselves. But some of them are so young, they are easily swayed by these older people, and therefore it makes it very, very difficult for them to actually do. So we need also to create a sense of purpose in the mind of the young girls and young boys, so that they don't see sexual intercourse as something to aspire to, as an achievement. It is not an achievement, but it is a huge responsibility, that it is better to postpone it and do it when you are able to take care of yourself, when you are in a committed relationship, when you are old enough to look after the consequences of that.
Indeed.
That's the one part which pertains to the individuals. So as Lovelife, we have a network of Y centers throughout the country. For example, I was in Botshabelo in Free State last week. We had around 100 young people that were there. And then we were partnering with the Department of Health, educating them. The guy who was the nurse who was talking to them one-on-one during that time that I was there, told me that one of the biggest issues that he found was that the young people thought that, for example, things like HIV and AIDS are no longer there. You know, they did not have information about available government services in some of the clinics, for example. So we need to raise awareness and information about what government and other partners are doing already to address the problem. So Lovelife is one of those organizations that are out there working. We have groundbreakers all over the country in communities, educating young people about this. But we need the other structures to hold the perpetrators accountable. And
Patrick, you touch on such an important issue. I mean, you've touched on many important issues, but the justice system is one where it is a major problem. I mean, in South Africa, sex with a girl below 16 years old, or where the male partner is 2 years older than the girl, is considered statutory rape. And, you know, it just becomes increasingly difficult, if not futile, to attempt to report the matter to social workers and police. And this is probably one of the biggest problems. And then the loopholes that exist in the legal framework when it comes to the age of consent for sex, and to prove that this was indeed, not a consensual sexual experience that was held. There are so many the dynamics at play here, and these are the things that we need to get more involved in, and have so many areas come in. But the Justice Department, in setting examples, is one loophole that unfortunately is a massive problem. Patrick, very quickly, the justice system in all of this, what role does it play? I mean, how is it letting victims down right now?
The justice system depends on the investigation at the point where things are happening. So if, for example, an event or an accident has not been reported and the police didn't come on time, if a child had been sexually molested, they have not been, the whole testing has not been properly done. Down the line, it's going to be very difficult then to provide the kind of evidence that is needed. So it's a chain that requires that communities cooperate and make sure that these cases are reported. So you don't want a situation where a child comes and reports at home and the home says, listen, let's talk about it. as a family, let's close it, or let the perpetrator come and give us money, and the whole thing is paid away. So it's a multiplicity of problems that lead to the justice system being sometimes unable to do this. But the other problem is that it has been said before that some of the police just say, at the police station, they just send the children away, go and talk to your parents about this thing. So we want those things to be turned around and changed so that the justice system is empowered with all the evidence so that they can make the proper decisions. We want them to be able to increase the number of convictions in this area.
All right, gentlemen, I so badly want to speak to you more because I feel like we haven't got anywhere. There is just so much to talk about. But joining us for this conversation was Basic Education spokesperson Elijah Mhlanga and Lovelife CEO Patrick Kulati, speaking about the rising rates of teenage pregnancy. In fact, it's so alarming that the World Health Organization has said that in South Africa, 1 in 4 women under the age of 20 fall pregnant. 1 in 4. That is the number that we're dealing with in this country, the highest in the world.